Hi, I'm Christine Iggy from 106.7 Light FM. Welcome to CEO Unplugged. And today I'm sitting down with Marki Flannery.
Good morning.
Marki, good morning, is the CEO for Visiting Nurse Service of New York. And welcome. I'm so happy to see you here.
Thank you. I'm so thrilled to be here with you this morning.
Well, I've heard such wonderful things about Visiting Nurse Service of New York and everything you have to offer. So I think we should start there. Can you please tell us about the company?
Absolutely. I'll start with the history of the organization. So back in 1893, Lillian Wald, who was one of the first public health nurses, started making home visits to people, immigrants on the Lower East Side. And that was really the start of public health nursing and the founding of Visiting Nurse Service of New York. So today, 125 years later, we continue to provide care to individuals, not only those that we started with on the Lower East Side, but throughout the New York area. So through Lillian Wald's efforts, we've developed a mission where we are focused on providing care to New Yorkers, and that includes services through our home care services, our hospice, our health plans. And about 20 years ago, we started providing health plans to people who have Medicare. So those are the over 65, as well as people who have disabilities, and Medicaid, which are people who are at poverty level, to assist them with receiving the services that they need to be able to remain at home.
That's wonderful. Yeah, because everybody deserves access to great health care.
Right.
And for people helping us, a lot of us are stuck in, what they're calling the sandwich generation,
Right.
where we're raising kids and our parents are getting older and might need some added care and attention. Is that where you can help us?
Well, absolutely. And that is the story of the life of many of the people that we serve. And I've been down that path myself with my own parents while I had younger children. So it is something near and dear to my heart to be able to assist people who are in need of care, whether it's at the end of life or as a result of some injury or illness that is temporary.
And would the care be 24/7? Would it be daily visits, or do you tailor it to someone's needs?
We tailor it to their needs. We have nurses who make in-home assessments at the start of care and evaluate what that patient's needs are, as well as what their insurance will cover, because unfortunately insurance does play a role in how much care an individual will receive. We're fortunate in our organization because we also receive charitable contributions from donors, and we're so grateful for that because we are able to supplement at times care for people that would not be paid for by insurance. But back to the question, our clinician goes in the home, assesses the patient's needs, and then evaluates whether they need a nurse, a social worker, a physical therapist, perhaps a speech-language pathologist, a home health aide. And we have people who get 1 or 2 visits, and that's all they need. And we have others who are receiving 24 hours a day for years and years.
Right. Well, how does the process get started? That's where you come in. But do we start with our doctor?
It always gets back to the doctor. But the doctor may make a referral directly to our organization by calling and asking us to send someone to a patient, and they'll give us an order letting us know what that patient's needs may be. Or if there's an individual being discharged from a hospital or a nursing home, perhaps, we'll get a request from one of those facilities asking us to provide care. And then we will have our clinician go in the home, do that assessment, and prescribe the care in collaboration with the physician. And we have things ranging from a patient may have a wound that requires many nursing visits to help heal that wound and to prevent an infection. Or we may have a patient who has had a stroke and now needs help walking again. So our physical therapist may come to the home and assist them with physical therapy services so that they can get back on their feet and back to ambulating again. Or a speech-language pathologist to help them with the aftermath of a stroke and care. And then we have our wonderful home health aides, which are the life-saving portion of the care. They go into the home and they do everything from assisting with personal care to helping with shopping, cooking, laundry, and making sure that the patient's taking their medications and safe, and so that they don't fall and that they can get in and out of bed carefully.
Absolutely. And the companionship too.
Correct.
The looking forward to having a visit from a friendly, helpful face. And I think also knowing that this is available is so reassuring because, again, you and I have been in this situation. You get a diagnosis, your doctor says something's happening with your loved one, a family member, and it can be so overwhelming and you don't know where to begin. So this first point of contact, the person coming to your home and saying, it's okay, we're going to help you come up with a plan,
Right.
is just so important.
Absolutely. So I actually have a I receive letters all the time from patients and family members, but there's one that always sticks in my mind, and I call it my favorite letter. And it was a letter that I received that ties to what you're talking about, from a woman who's 88 years old, and her husband had been in the hospital and was being discharged after 5 weeks in the hospital and 2 weeks in rehab. They were married for 68 years, and they'd never been apart for that long. And so while she was happy that her husband was coming home, she was petrified and worried about how she was going to manage him, herself being 88 years old.
Yeah.
So within an hour of her arrival, as she stated to me in her letter, her doorbell rang, and she opened the door, and there was a young man named Taman Pang, who introduced himself and said, "I'm here to take care of your husband." And they sat down, and he told her what he was going to do for her and her husband. And she then told him how worried she was and how she wasn't going to be able to manage him on her own. And he reassured her and told her, "Don't worry, I'm here for you, and we'll get through this together." And they did. And she said in her letter to me how much she appreciated his care and how much she's going to miss him when she loses him, but knowing that he's needed elsewhere. And then, of course, sent her blessing for every visiting nurse in New York, which was
so
just wonderful. So it stuck in my heart. It was just an incredible letter.
I can see why. And I can see why this work is so gratifying. You're really making a difference in people's lives. You're really helping people. So, Marki, what brought you initially to visiting nurse services?
When I graduated college and I was going for my master's degree, I took on a job in a home health agency. And my role was to assign home health aides to service patients. It wasn't Visiting Nurse Service of New York, but I then, that company had a contract with Visiting Nurse Service of New York. So I got to meet people in that organization, and VNSNY then decided that they were also going to build a similar organization that provides home health aides within their own company, and asked if I would be willing to join and assist with that build. So I left my position, went to VNSNY. That was almost over 36 years ago, and I've never looked back. It was the best decision I ever made. I had a number of different roles in that organization, and it just was something that pulled at my heartstrings, and I felt that I was making a difference, and that really mattered to me.
Marki, I want to congratulate you. Last year, Crane's New York business selected you for its first ever list of notable women in healthcare, which sounds like an amazing honor, well-deserved. With all of these wonderful accomplishments, what are you most proud of? Is there one thing that stands out to you?
So I was really pleased to receive that recognition. It was very special to me and clearly unexpected. But the thing that probably stands out most to me as something I'm most humbled by is the decision that was made by the board of directors to appoint me as the CEO of Visiting Nurse Service of New York. I had been with the organization for 36 years, and to have the opportunity to step into that role and lead the organization as we plan for the future was really very special to me. The staff has been incredible and supportive as we're working on developing new strategies to position the organization forward. And the fact that this happened during our 125th anniversary was especially important to me, and something that just really touched me.
Yeah, well, I can see how you're very, very passionate about this and believe in the work that you're doing. And we appreciate so much the work that you're doing Who do you think has influenced you the most in your professional career?
So the first position I took in home health care was in an agency similar to ours, to Visiting Nurse Service of New York. And then I joined VNSNY's Partners in Care division. And Partners in Care's leader, president at the time, was a woman by the name of Sharon Hamilton. And when I worked for Sharon, Sharon was really smart. Sharon was really demanding, and it was very clear that you needed to know your information when you responded to questions that Sharon asked of you. So I learned to be very prepared. I learned to not only be familiar with the information that pertained to the business I was responsible for, but to also learn about other parts of the organization and be prepared to respond and be part of discussions related to other aspects of the organization. And I think that her basically making me do that, helping me to learn to broaden myself, really helped position me for future success. And so during my time working for Sharon, I had a number of opportunities within the Partners in Care business. And then ultimately, I became president of that division, and I stayed in that role for about 15 years before rejoining Visiting Nurse Service of New York.
I hope there's a lot of people learning from you right now because this is absolutely wonderful. What excites you the most about your work and why?
What excites me the most are the people that I work with. I work with the most amazing 14,000 people in the industry. Nurses, therapists, social workers, home health aides, and all of the staff who help support our business have incredible passion and drive to do right by the patients that we serve. This past March, when we had the unexpected snowstorm and the mayor and governor said, stay home, our staff did the exact opposite. And they got on their bicycles and their cars, or they walked and they went to take care of patients. And these are the same people who, during 9/11, crossed the frozen zone to get downtown to service patients. They're the same people who, during Superstorm Sandy, climbed dozens of flights of stairs in the Rockaways to make sure that people were okay. And if they needed medication, we made arrangements to get it for them. They just inspire me every day, and they make my job easy.
These are our real-life heroes.
They are the heroes, absolutely. My job is easy. It's their job that is just incredible.
Well, what you're doing is incredible, Marki. And just one last question. What's the best business advice you've ever gotten?
So my father gave me the best advice. He was an immigrant who came to this country from Italy. And when he got his first job, it was in a factory. And over time, had an opportunity and ultimately became manager in the factory that he worked in. And he would come home at night and he would talk to me and to my siblings about the importance of earning that paycheck. He said, you never go to work thinking you deserve a paycheck. You go to work and you earn that paycheck. And every day you find a way to make the people you work with proud. And it's never left me. And it's something that I've shared with my family, my own children. And here we are, many, many years later. I never forget what he shared with me.
It is. It's wonderful advice. Thank you for sharing your story with us.
You're very welcome.
So please tell us the best place to go for information, to get started, everything we want to know about.
Absolutely.
Visiting
So
Nurse
we
Service
have
New York,
a great website, www.vnsny.org. Or if you want to call, you call 1-888-VNS1, the number 1, call. And one of our terrific staff will help assist with answering any questions and helping to make arrangements if that's the care that you need.
Okay, great. Thank you so much.
You're
welcome. Once again, this is CEO Unplugged with Marki Flannery, Visiting Nurse Service of New York. I'm Christine Nagy. We'll see you next time.